today to DDM Health News Updates. On our program, Your Health, Your Wealth. Nice having you back again today. As a reminder, listeners, if you have not subscribed to our YouTube channel, please kindly do that. If not, you'll miss a lot of our latest health news updates. So please try to do that, okay, so that you don't miss at all. What do you have today? In a bold move to deepen access to quality healthcare and curb the tide of medical tourism, the coordinating Minister of Health and Social Welfare, Professor Ali Pates, alongside Lagos State Governor Mr. Babajide Sanwo-Olu, on Monday, commissioned a 50-bed ultra-modern medical facility built by Avon Medical in Surulere, Lagos. The facility, with state-of-the-art diagnostic and treatment equipment, was established by Dr. Elumelu, wife of business mogul and chairman of Hairs Holding, Mr. Tony Elumelu, with a mission to improve health outcomes in Nigeria and offer world-class care within the country. What a thoughtful act. Wow. Very soon we'll be enjoying in this country together with the Elumelu's company. Speaking at the unveiling ceremony, Governor Sanwo-Olu underscored the importance of private sector participation in strengthening the nation's health sector. That's very thoughtful of the governor. The government alone cannot shoulder the responsibility of healthcare delivery, Sanwo-Olu said. We are creating the right environment for private investors like Avon Medical to thrive and bridge the gaps. That is the gaps that we're having here in Nigeria. So very soon, the Lagosians will enjoy the medical outreach. He praised Avon Medicals for its commitment over the last 16 years, noting that such investments align with the state vision of universal health coverage. Also speaking, the Minister of Health, Professor Ali Pates, represented by the Chief Medical Director of Lagos University Teaching Hospital, Professor Wasio Adeyemo, commended the initiative, describing it as a landmark in Nigerians' healthcare journey. What we are witnessing today is a new phase of private sector-led healthcare transformation. He said, with facilities like these, we are gradually addressing the root causes of medical tourism and improving confidence in our health system. That's very great.
Fine.
Furthermore, Pates revealed that the federal government was ramping up efforts to upgrade tertiary institutions and welcome private collaborations that meet global standards while remaining people-focused. Also, the Avon Medical Facility boasts a high-end diagnostic center featuring a modern CT scan unit, emergency and trauma care services, intensive care and pediatric units, and a fully equipped theater, all tailored to serve both privileged and undeserved communities. Wow, so thoughtful. In a heartfelt address, Dr. Wele Elumelu traced the journey of Avon Medical, which began in 2009, driven by a vision to make healthcare equitable and accessible. We started with one clinic. Today, we have grown into a network that spans a 50-bed hospital, a dialysis center in Ikeja, and several work-site clinics nationwide, he recounted emotionally. Speaking further, Elumelu said the new center was a contribution to addressing systemic issues plaguing African healthcare, including the Japa syndrome, where Nigerian health professionals flee abroad to search of better working conditions. So, Nigerian workers should have great courage that they will be having a work very soon. No longer feeling abroad. This facility is more than a building, it's a lifetime. It means more women will access maternal care, more children will survive illnesses, and more families will receive timely and affordable treatment, she said. She lamented that Africa bears 20% of the world's disease burden, but accesses only 1% of global health resources, urging stakeholders to build systems that leave no one behind. Tony Elumelu, in his remarks, praised the Lagos State government for its support and reaffirmed her holding commitment to social impact and development across Africa. We are passionate about solving African problems. Healthcare is one of them, and with Avon Medical, we are offering our real solutions, he said. Well, the event drew high-level stakeholders in the health and investment sectors, reflecting a united front in pushing for sustainable health reforms powered by public-private partners. It was indeed a lovely gathering. Up next, medical experts have raised alarm over the increasing misdiagnosis of lupus among Nigerians, warning that individuals who are treated for malaria or typhoid more than 10 times in a year may be battling a more serious underlying condition. So please, take notes. How many times have you treated malaria and typhoid this year? He further explained the health professionals, while speaking exclusive to Punch Healthwise, noted that such recurring symptoms, fever, fatigue, and body pains, are classic indicators of lupus, a chronic autoimmune disease that is often confused with common infections in Nigeria. According to the Mayo Clinic, lupus is a condition where the body's immune system turns against its own organs and tissues. This internal attack can lead to widespread inflammation, affecting the joints, kidneys, skin, blood, brain, and heart and lungs, showing that it's a very critical disease. While the exact cause of lupus remains unknown, experts believe it could be triggered by genetic factors, infections, hormonal changes, or environmental influences, such as exposure to sunlight. So please, check what are the places you go, what are your environmental influences, where and when did you go often. Though there is a no cure yet, early diagnosis and appropriate treatment can help control its symptoms and improve the quality of life. A consultant rheumatologist at the Lagos State Teaching Hospital, LASUT, Dr. Hake Olasebikan, stated that lupus symptoms are easily mistaken for malaria or typhoid, leading many Nigerians to undergo repeated treatment without any lasting relief. Of course, most of us, we might treat with this, for instance, artemether lumefantrine. If it doesn't work, you go for sulfadoxine plus pyrimethamine, not knowing that you're having lupus. In Nigeria, if someone treats malaria or typhoid more than 10 times in 1 year, we have to start thinking beyond infection. It may be lupus, Dr. Olasebikan cautioned. He stressed that lupus can present in various ways, mimicking familiar infections. You have symptoms like fever, weakness, joint pain, body aches. People just assume it's malaria or typhoid, but those illnesses don't linger that long. He added that lupus could also cause anemia, leading to unnecessary blood transfusions or more serious complications such as kidney failure, hair loss, and skin rashes. Lupus is an invisible illness. It hides under symptoms that look like common ailments, and that's why many cases go undetected for years. That was what Olasebikan said. He explained that all these things are hidden inside the body. He also revealed that women are disproportionately affected, with a female to male ratio of 10:1, largely due to hormonal influences, particularly estrogens. Well, but the challenges doesn't end with diagnosis. Olasebikan lamented that access to proper diagnosis and treatments remains out of reach for many Nigerians, as the cost of tests and medication can run into millions of nairas. Some of the latest, more effective medications are not yet available locally. But looking at these aspects, the government needs to step in. Yes, it's not enough to know that treatments exist. Patient needs to be able to afford it. The financial strain alone can lead to mental health issues. So please, government, try to step in this aspect. as lending her voice to a consultant dermatologist at the University of Ilorin Teaching Hospital, Dr. Toyosi Ilesami, warned that lupus could damage virtually every system in the body, from head to toe, your brain, your joints, your kidney, your liver, every part of the body. Lupus can lead to scarring skin rashes, hair loss, oral ulcers, joint pains, and even stroke or dementia if it affects the brain. That was what she explained. She stressed that lupus also could reduce the body's ability to produce red and white blood cells, exposing patients to life-threatening infections or anemia that requires frequent blood transfusion. You can see how costly things are this time around. Even a pint of blood is not even affordable here in Nigeria. So please, we shouldn't take this case as a play or joke rather. In some severe cases, patients may stop passing urine entirely due to kidney failure. In others, it could mimic leukemia. That's how serious and deceptive this illness can be. Dr. Ilesami called on the Nigerian media to intensify public sensitization, noting that increased awareness would save lives. Just as we are telling you right away, if you haven't subscribed, you won't get this latest news. So please try to do that. Every Nigerian must be aware that if symptoms persist despite treating malaria or typhoid, it is a time to ask deeper questions and see a specialist. The experts urge citizens, especially women and young adults, to seek specialist care when symptoms become chronic, as early detection and management remain the most effective way to combat the disease. So please, don't fail to see a specialist if the symptoms are chronic or continuous in order not to get lupus. Up next, the Lagos State government has reopened the popular Ketu market following compliance with environmental sanitation directives, even as 11 other markets within the Ketu and Mile 12 axis remain sealed for persistent waste management infractions. Please, these ones that are remaining still, try to clean up your environment so that they can open it too. Of course, they don't open Ketu, oh no. The State Commissioner for the Environment and Water Resources, Mr. Tokumbo Wahab, made this known via a post on his official X handle on Friday. Wahab explained that the reopening came after traders at the Ketu market carried out a thorough cleaning up exercise and demonstrated readiness to uphold environmental standards. You see what I'm talking about? Had even they never had a thorough cleaning up exercise, definitely their markets wouldn't have been open. And these are the ways people survive over there, the markets. Market stakeholders must take responsibility for proper waste management going forward. Let us work together to build a cleaner, safer, and more responsible Lagos, he stated. The commissioner further revealed that the enforcement operation, which led to the sealing of several markets on Thursday night, was in line with the Lagos State Environmental Management and Protection Law of 2017. You can imagine Lagos being a dirty place. Because of that, the market is being sealed. The former capital territory of Nigeria. That's so sad to hear. The crackdown was necessitated by the indiscriminate dumping of refuse on roads, medians, and highways, posing serious threat to public health and urban order. Among the affected markets still under lock and queue are Erukan Market, Mile 12, Ojoba Market, Ketu, Owusini Tundas Market, Oba Ogunjobi Market, Mile 12, and several shop clusters at the BRT terminal and Mile 12 bus stop. These are markets that are still sealed up. Others include Ifesowapo Market, Mile 12, Demurin Street Plaza, Ketu, occupants of 6 Demurin Road, Ketu, Ifeludu Market, Ketu, Ibadan Unit 1 Park, between Babajide Sanwo-Olu Market and Ikosi Fruit Market, and the Ketu Tipa Garage. So sad. Wahab emphasized that the state government remains committed to enforcing environmental compliance across the metropolis, urging all market leaders and traders to embrace proper waste disposal practices to avoid future sanctions. Are you hearing that? Please adhere to the law. We cannot afford to compromise on public health and environmental sanity. This is a collective responsibility, he added. So please, everyone should take responsibility of that in order not to drop things on the road. Up next, for nearly a year, Patience, though not her real name, has lived in silent grief, unable to talk about the unimaginable pain of losing her two children within 2 weeks. Her neighbors remember the harrowing ordeal, one that underscores the critical health access crisis in parts of Enugu State. So sad. According to this story, it was a rainy morning when tragedy first struck. One of Patient's children fell seriously ill, with no nearby health facility and the child's condition worsening. She and her husband embarked on a desperate journey to Goodwill Medical Center, that is GMC, Umuchiwo, a health facility just a few kilometers away. Well, ordinarily, it would have been a 20-minute walk. But the path was obstructed by the raging Ava River. This raging Ava River, which separates the communities of Ifo, Uboezeji, and Ubopol in Enugu State East local government area. With no bridge in sight and unable to afford the roundabout trip via commercial vehicles, the couple chose to walk or to cross the river on foot. You have to put these people in your shoe. The story foretells further. The father carried the ailing child while supporting his wife through the gushing waters. Drenched, shivering, and frightened, they eventually reached the hospital. But it was late. The child had died. Succumbing to the cold, exhaustion, and the long journey through the river. You can imagine what it means using the foot to cross a river. The family would lose a second child just 2 weeks later. An avoidable tragedy that cast a shadow over an entire community. But on Tuesday, April 8, 2025, the story changed for a little better as the much-awaited Avon River Bridge, a pedestrian and tricycle accessible crossing, was officially commissioned to wide jubilation by residents. Listen further and know what happened. The bridge, a lifeline to over 3 communities, was built at the cost of 38 million naira through the selfless efforts of Professor Uche Amazigo, a former WHO director and founder of GMC, with support from the T.Y. Danjuma Foundation and other public-spirited Nigerians. Wow. Thanks for your heartfelt work. We appreciate. Addressing the gathering during the commissioning, Professor Amazigo described the bridge as a symbol of hope, progress, and unity, adding that it reflects a community's collective will to end needless suffering. The chairman of Enugu East local government, Mr. Beloved Dan Anike, who performed the tape cutting, commended the initiative and promised further infrastructural development in the area, including roads and a mini bridge to serve adjoining settlements. Wow. As the story continues, delivering a heartfelt keynote, GMC trustee Professor Ann Ndo lamented how access rather than availability remains a major health challenge in rural Nigeria. Of course, it is. Because availability without access does not work. Imagine being critically ill and there's a fully equipped hospital within reach, but you cannot access it. It's a cruel irony, of course. Professor Amazigo went above and beyond, drawing from personal resources and rallying the public to see this project through. She is a national inspiration. Indeed, she is. In her remarks, Professor Mazigo reaffirmed GMC's commitment to serving vulnerable communities and complementing government's efforts. This bridge is more than steel and concrete. It's a commitment to human dignity, to the right to health, and to the ending preventable deaths. We remain grateful to our partners and the Enugu State government for supporting our vision, she stated. But apart from that, residents were so happy. Residents said the bridge will change their lives. Wow. We can now take our children to hospital in time, even during the rains, said Mrs. Ifoma Naji, a local mother. This bridge has brought us peace, another commented. For communities in Enugu East local government area, the Ava River no longer stands as a barrier, but as a testament to what is possible when vision meets action. Check it out. When a vision meets its action, definitely things will go through. Well, listeners, this will come to the end of today's news on your Health, Your World program. Do ensure to click on the like button, share, comment, and subscribe to our YouTube channel so as not to miss these lovable stories on your health. Until next time, I remain your host, Nenyoro Michael Nezimi. Do have a wonderful and beautiful day ahead. Thanks for watching. Bye for now.